I think it's still relevant, and I'm very much for the continuation of exclusive remedy, primarily because I think it introduces something into the workers' compensation arena that doesn't exist, generally speaking, in any of the other elements of law. And what it does is, or it's actually what it takes out of the scenario. It takes fault out of the scenario, and so it is a system in which we can move beyond a quick allocation of fault and try to get both medical care and indemnity payments to an injured worker who has a compensable claim. Workers' comp is a no fault scenario. We don't worry about fault, and so if we jettison the exclusive remedy, do we expect the employers to still pick up the cost of medical care? As I see the issue with regard to antagonism, there seems to be a feeling on part of both claimants and employers that the original grand bargain of the workers' compensation scenario has changed over the years such that the original balance between the two parties has been lost. From the claimant side, however, for example, I think many times they tend to forget that there are a whole host of benefits that are currently being paid under the workers' comp scenario that were never originally embodied into the original acts. For example, the original acts did not have any payment for occupational diseases. The original acts did not cover repetitive motion injuries in most cases. That was because the original acts had a real emphasis on the accidental nature of the injury. And so something that happens a little bit at a time over a long period of time, a repetitive injury, was generally not covered. They are covered now. Mental injuries, for example, were not originally included in the concept of workers' compensation benefits, particularly what we would call mental injuries, those mental injuries that are caused by a mental stimulus and not a physical injury. As I've talked with some others, there's also a certain irony involved in some of the states where, for example, Florida, which was your original Paget litigation state, where it said where a judge in Florida said that the scale had been tipped too far toward the employer and declared a portion of the whole act unconstitutional. The interesting thing about it is that under the original acts, there would never have been any payment for COVID-19 claims, and yet in Florida, where the Paget discussion was had as late as at the end of April 2021, some 42,000 claims had been paid on COVID-19 illnesses. And at least as I understand it, more than $38 million had been expended in terms of claim costs. So the notion that the erosion has been only one-sided, I think is an improper assumption. The erosion has been both on the employer's standpoint and on the claimant standpoint as well. The only real way to bridge the gap between the two sides of the issue is sort of a twofold answer. One, all too often, we tend to forget that there are more than two parties to the table, at the table. Yes, there's a claimant's issue. Yes, there's an employer's issue, but society has an issue as well, because if the system breaks down, it is going to be society which gets stuck with the cost. In other words, will Medicare expenses go up based on the fact that we have a whole bunch of disabled employees? So one of the ways to bridge this gap is to make certain that we have the public interest involved in any of these discussions about whether we get rid of the exclusive remedy or not. And then the second thing I would argue is that because the erosion of the original grand bargain has not been one-sided, it's been two-sided. Both sides in terms of the employer and the employee, they need to recognize that the other side has also had its rights and remedies altered over these many years. And so sometimes if you understand from where the other party is coming, you do a much better job in terms of understanding where you should go.
Relevance is a consideration within a continuum. It was originally created, the workers' compensation system, to be an expeditious form of remedy, an exclusive remedy, a remedy that would take care of workers who could not otherwise be taken care of. And on the flip side, to allow employers to go unmolested about their business without fearing lawsuits. It has to be viewed against a backdrop of 100 other interrelated systems that were not foreseen and not created at the time. For instance, the New Jersey Workers' Compensation Act was created in 1907, as an example, one of the earlier acts. So let's talk about what it was like then. In 1907, the legislatures that met, the governors that met with organized labor and with capital, we're living in a world where the average bill for treating a workers' compensation injury was $20, where half or more than half of all surgeries were performed in the patient's home, where people lived and worked near subsistence wages, where self-employed people would lose everything if they were injured at all, where there were no such things as health insurance policies, not until the mid-1930s with the advent of Blue Cross, and then outside of hospitalization 2 or 3 years later with Blue Shield. It wasn't until Medicare and Medicaid were foreseen that we really saw the erosion of the exclusivity of the remedy in reality and in practice, and the leveraging of later created systems. Now, we live in a world now in workers' compensation where the rules are judged by the exceptions. My clients want to run as far and as fast away from the compensation system in New Jersey as they can. They would much rather be able to choose their own physicians. They would much rather have less structured oversight over their disability and their treatment. They look to state temporary disability benefits, which weren't created until the Social Security Act created a reason actually for unemployment to be created, and thereafter for temporary disability benefits to be created in the late 1930s. I think Wisconsin was the first. So here we see over the first 25 or 30 years of the Act, it was as it was envisioned, truly a limited remedy that was supposed to be expeditious and that had no co-equal or collateral remedy available for the people who were supposed to be the beneficiaries as it was first envisioned. Within 20 or 30 years, collateral remedies were created. 40 or 50 years later, we saw the advent of widespread provision of health insurance benefits as a first-party benefit, where your insurance company was less an adversary than a fiduciary, particularly in union health and welfare plans. So it's been a continuous process of eroding both the reason behind the rules we have in workers' compensation and the actual practice, as people in disputes had to go outside the system in order to get expeditious medical care, expeditious sustenance benefits, subsistence benefits. All that's left is the contingency part of the practice, the permanency. And in those cases, where there is total permanency, we've seen Social Security disability and private ERISA-based policies subsuming even that as a sole and exclusive remedy through workers' compensation. So that's why. Component that we have to deal with now in our system, the runaway costs, are from health insurance. There are so many parallel and interlocking systems. But what I would really like to see is that workers' compensation lead the way in getting away from fee-for-services medicine and converting us from a fee-for-services system to a diagnosis-related system, so that the negative incentives for the stakeholders who provide medical treatment are removed from the system. I think that would also create a greater sense of satisfaction and choice on the part of the industrial workers who really were supposed to be the beneficiaries of the act in the first place.